most common fungal infection we encounter in our day-to-day practice is ringworm infections, which is also called as Tinea corporis in medical terminology. In such infections, it's always good to avoid tight-fitting garment. Try to wear thin, loose, breathable fabric-made garments, especially made of cotton, will be good. Avoid wet clothing, which can aggravate your problem. Topical antifungals like terbinafine or azole groups of drugs, something like ketoconazole, ibuconazole, aliconazole, etc. can be applied on the affected area. The topical agent should be applied adequately on the entire plaque, and it should extend 2 cm beyond the affected margin to the normal surrounding skin. It should be applied twice a day for minimum of 3 to 4 weeks or 2 weeks beyond after the resolution of the patches in case of Tinea corporis. In case of Tinea pedis, it's always good to avoid tight-fitting footwear, especially shoes, and use socks which is made up of cotton, and it should be changed every day. Keep your feet very dry, especially the toe web spaces has to be taken proper care, because that is the site where the organisms can lodge and multiply. And avoid wet work for long duration. Topical antifungals, as mentioned before, can be applied for minimum of 4 to 6 weeks duration or 2 weeks beyond after the resolution of patches. In case of jaw itch, it's always good to avoid thick fabric garments or tight-fitting clothing, so that can aggravate your problems. And in case if you sweat a lot, it's always good to take bath twice a day. Topical antifungals, as mentioned before, can be applied. It's always good to use lotion or gel-based preparations over the hairy areas for better penetration and easy application, and also for better results. And the other fungal infections like candidiasis can happen over the intertriginous areas, so these areas should be kept dry, and the topical antifungals, as mentioned before, can be used. And also you can use powders which can keep these areas dry. Even if using or after using topical agents you are not having good improvements, it's always good to consult your nearest dermatologist and start on oral antifungals as per their advice. Some of the do's and don'ts in case of fungal infections are like, always try to wash the infected person's clothes separately. If it is possible, better put it in hot water for 15 to 20 minutes and wash, and then let it dry in hot sunlight. And if possible, if you can iron your clothes, it's always good. Avoid sharing any of your things like personal care items, something like soaps, towels, shoes, clothing, with other persons, so that you will be transmitting your infection to others as well. And always keep the areas which are affected badly dry, and in case if possible, try to take bath twice a day. And in spite of all this proper care, if you are not responding, it's always good to consult your dermatologist.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.